You have been diagnosed with type 2 diabetes. This is a disease that affects over 15.7 million Americans. Although it is not very common in young adults, it is a condition that needs to be watched closely so that you do not develop complications. This presentation will teach you why is it important for you to keep your diabetes under control, what exactly is diabetes, what things put people at risk for developing diabetes and what they can do to decrease their risk, what symptoms they should look for, and how to live with this condition. It is common for diabetes to go unnoticed. It may develop slowly, therefore making it more difficult for someone to realize that there is a problem. Complications can arise when this disease goes unnoticed and uncontrolled. Diabetes is a major risk factor for the development of heart disease and stroke. It is also the leading cause of blindness and long-term kidney disease. Not taking care of yourself and leaving your diabetes uncontrolled can lead to serious and widespread problems that affect your entire body. Some of these conditions include skin infections from bacteria and fungi, eye conditions such as glaucoma, cataracts, or retinopathy. These things can decrease your vision and even lead to blindness. Another serious complication is the nerve damage that can occur throughout the body. Being diagnosed with diabetes as a young adult increases your chances of developing these conditions over time. That is why it is important to take care of yourself now and do the things necessary to keep your diabetes under control and decrease your risk of these serious complications. Diabetes You may be asking yourself, so what exactly is diabetes? Well, it's a condition that leads to high levels of sugar in your blood. It occurs because your body doesn't use the sugar it gets from food properly. So let's start from the beginning. Your body uses sugar to produce energy. However, there's a process that must happen in order for your body to get access to the sugar. And this process involves different organs and hormones in the body. So near your stomach is an organ called the pancreas. It is in charge of making a very important hormone called insulin. Insulin regulates the levels of sugar that are in your blood by helping the sugar get into cells so your body can use it for energy. This insulin also helps the extra sugar to be stored in your liver so it can be used later on. When you eat food, it is broken down in your stomach. The sugars from your food are absorbed by your body and enter in the bloodstream. As your blood sugars rise, your pancreas begins to release insulin. The insulin lets your cells know that they need to absorb the sugar for energy. If there are sugars left over, then the insulin helps your liver store it for later. Between meals, the stored sugar can be released so your body can use it for energy. When your body produces a lot of sugar, your pancreas has to work harder to produce more insulin. Over time, the cells in your body become tired and do not respond to the insulin as well, making it more difficult for the sugar to be absorbed by the cells and taken out of the bloodstream. This is known as insulin resistance and is one of the causes of type 2 diabetes. There are certain things that increase a person's chance of getting diabetes. Having a first-degree relative like your mother, father, or sibling who is diagnosed with diabetes puts you at a greater risk of developing the disease. Being obese or having a body mass index of 27 or greater also increases your risk. Other factors include race, high blood pressure, high triglycerides, and a low HDL. Certain medications such as steroids, hormones, NSAIDs, and nicotine can also play a role in the development of diabetes. It is important for you to be familiar with the symptoms of low and high blood sugar so that it can be treated quickly before serious issues arise. If your blood sugar drops too low, your brain will not be able to get the energy it needs to function properly, and extremely low blood sugar can cause you to pass out and even go into a coma. When your sugar gets too low, it is known as hypoglycemia. When it reaches a level below 70, you may start to get a headache or feel shaky and dizzy. You may even start to be sweaty and get clammy. Everyone has different symptoms, but you need to be aware of how your body may react. If these symptoms occur, it's important that you quickly check your blood sugar in order to determine if it is low. If it is low, you should immediately ingest some form of sugar or glucose, such as glucose tabs, orange juice, or a Coke. Recheck it in 15 minutes. If your level has returned to normal, you should eat something to keep it from falling again. If it continues to be low, you will need to seek care from a health provider. Hyperglycemia is the term used to describe a high blood sugar. This is considered a blood glucose level of greater than 240. When sugars become significantly high, we can begin to worry about the risk of developing ketoacidosis. This condition can lead to a coma and be fatal. It's important to watch for symptoms of high blood sugars, such as fruity smelling breath, abnormal breathing, a rapid and weak pulse, and confusion. If you experience any of these symptoms, you need to notify your provider and seek treatment immediately. Your blood sugar or blood glucose level is measured in several different ways. Your healthcare provider may use a test called a hemoglobin A1C to get an average of your blood sugars over time. Individuals who are diagnosed with diabetes typically have a hemoglobin A1C that is greater than or equal to 6.5. You will also be instructed on how to check your sugars at home by using a blood glucose monitor. This allows you to measure your glucose level at any given time from a small drop of blood from your finger. By keeping track of your blood sugars at home and sharing these results with your healthcare provider, this provides a simple way of ensuring that you are maintaining target glucose levels. You have been diagnosed with type 2 diabetes. You will need to begin doing in order to manage diabetes. Over 15.7 million Americans. It's very important that you take care of yourself. Although it is not very common in young adults, it is a condition that needs to be watched closely so that you do not develop complications in the future. You will begin this new way of living with lifestyle modifications. A well-balanced, wholesome diet that avoids processed foods and focuses on moderation will play an important role in your success. This will not only support your weight loss, but will help you to maintain healthy cholesterol levels. Moderate physical activity is also an important piece of this puzzle. This too will encourage weight loss, support a decrease in glucose levels, and complement a heart-healthy lifestyle. You will need to have several tests done in order to monitor your overall health and promote early detection of complications. Yearly eye and foot exams are very important for the diabetic patient in order to identify any eye conditions or foot problems that may arise. Because cardiovascular disease is so highly correlated with diabetes, frequent blood pressure checks and annual cholesterol levels will be done. Your kidneys will also need to be monitored by checking your urine for protein. Your general health maintenance should also consist of a yearly flu vaccine and a pneumonia vaccine if you have never received one. Lastly, you need to check your fasting blood sugars daily until you and your provider decide your levels are stable and can be monitored less often. Routine hemoglobin A1Cs will also be done to monitor your glucose averages. You will be started on a new medication called metformin. This is a very safe medicine that's used to help your body respond better to insulin that you are already making. This will help to bring your blood sugars down to a more appropriate level. You will take 500 milligrams by mouth every evening with your last meal. It's important to take this medication daily. You need to have your prescription refilled before you completely run out of your medicine. You also want to avoid drinking with this medication because it can cause your blood sugars to become too low. Okay, so let's review. Diabetes is a condition that occurs when your body has too much sugar in the blood. This can be as a result of your pancreas not making enough insulin or your body not being able to use the insulin that you have properly. Serious complications can occur if your diabetes is left untreated or if it is not adequately controlled. You will be at an increased risk for heart disease and stroke. Certain problems such as impaired vision or blindness, skin infections, nerve damage, and kidney damage can also occur. Being obese and not exercising can increase your risk for diabetes. Other risks include a first-degree relative with diabetes, hypertension, high cholesterol levels, race, and taking certain medications. Lifestyle medications, such as diet and exercise, can help decrease some of these risks. It is important to watch for signs and symptoms of low and high blood sugars. If your blood sugar drops too low, you should ingest a source of glucose, such as glucose tabs or high glucose food or drink, and recheck your sugar in 15 minutes. If it's okay, then eat a meal or snack to help keep it stable. You should strive to keep your A1C below 6.5 in order to effectively decrease your chances of serious long-term complications. Stay up to date on your immunizations and your routine checkups and labs. Remember the importance of taking your metformin as directed and avoid drinking with this medicine.